Welcome to today's Explainer. Today we're actually stepping into the realm of a real-life medical documentary to unravel a pretty fascinating mystery. We are looking at an invisible agent that literally surrounds us every single day, walking among us completely undetected. It's a microscopic entity that has touched the lives of almost every adult walking the planet, yet it remains profoundly misunderstood. It's honestly a staggering truth. There is a virus out there that has infected almost every adult on Earth. And the wild part, most of us never even knew we had it. For some kids, it causes nothing more than a few days of feeling kind of tired. But for others, the presentation can look absolutely terrifying, sending parents into a total spiral of worry and panic. Okay, let's dive into this. Section 1. The virus we all know. Unmasking Epstein-Barr. We're talking about infectious mononucleosis. The main culprit here is the Epstein-Barr virus, which is actually part of the herpes virus family. The medical name sounds super intimidating, doesn't it? But it's really just a very common viral infection. Because it spreads mainly through close contact with saliva, it's famously earned the nickname the kissing disease. But hey, you don't actually have to be kissing to get it. Simply sharing drinks, swapping utensils, or just having close household contact can pass it along. Crucially, though, it doesn't spread like your typical cold floating around the room. Just breathing the same air as someone usually won't get you sick. Section 2. Recognizing the symptoms and what happens when the body fights back. So the Epstein-Barr virus doesn't just wander around your body aimlessly. It's like it has a hit list. It specifically targets the tissues that make up your immune defense system. Imagine a map of your body's security checkpoints. The virus goes straight for the tonsils in the back of your throat, the adenoids, the lymph nodes scattered around your neck, and even internal organs like your liver and spleen. Because it attacks those exact defense centers, the symptoms can seem highly unusual and, frankly, quite severe. When all those immune tissues get inflamed, you get a combination of symptoms that is deeply alarming for any parent to witness. We are talking about an incredibly painful sore throat, complete with swollen tonsils and those frightening white patches. You'll see swollen lymph nodes in the neck, a high fever, extreme exhaustion, and sometimes a kid who suddenly cannot breathe through their nose at all. It is totally understandable why a parent seeing these dramatic signs would immediately think something incredibly dangerous is going on. Let's move to and see how this builds in Section 3, the Great Strep Mimic, a classic case of mistaken identity. Picture this. Your child has a raging high fever, a throat that feels like they're swallowing glass, and white spots everywhere. The immediate gut instinct for a parent is to assume it's bacterial strep throat, and the natural next thought is, we need antibiotics ASAP. It's a completely logical assumption, but in this medical mystery, jumping to that conclusion can actually lead us right down the wrong path. And this brilliantly illustrates the crucial detective clue that doctors actually look for. See, a typical bacterial strep throat usually does not cause a blocked nose. But if a child has that agonizing sore throat combined with a terribly stuffy nose, well, that points heavily away from strep and directly toward a viral infection like Epstein-Barr. That blocked nose is your smoking gun. Which brings us to Section 4, the antibiotic mistake, when the cure causes panic. Imagine giving your child an antibiotic, just hoping to help them feel better, only to suddenly see their body covered in this alarming, dramatic rash. The immediate, terrifying thought every single parent has in that moment is exactly this, quote, "Oh my gosh, my child is allergic to antibiotics." So the crucial point is, this is very often not a true allergy at all. It turns out two incredibly common antibiotics, amoxicillin and ampicillin, can trigger a massive, dramatic rash if they're given to someone who actually has infectious mononucleosis. The rash can cover huge areas of the body and look incredibly severe. But it's literally just a strange, non-allergic reaction between the virus and the medication. And this is exactly why doctors have to think so carefully before just throwing antibiotics at a severe sore throat. Moving into Section 5, treatment and recovery, helping the body heal. 0. That is the exact number of magic medicines out there that kill the Epstein-Barr virus. Because this is a viral infection and not a bacterial one, antibiotics are totally useless against it. And what about all those immune boosters and miracle meds you might see advertised online? Yeah, they haven't shown any reliable benefit either. The actual medical strategy here is what we call supportive care. The goal is simply to help the body do its own incredible work to recover. This means making sure they drink plenty of fluids, managing the fever and pain so they can actually rest, washing out that blocked nose so they can breathe comfortably, and just getting a ton of sleep. You aren't curing the virus yourself, you're just giving the body the environment it needs to cure itself. Let's clear some things up in Section 6, Myths and Facts. Time to set the record straight. First up, can you get it twice? You know, a lot of people think you can only get mono once. That's not completely true. After that initial infection, the virus actually stays in your body. While most of us do develop immunity, repeated episodes of symptoms can happen. However, a child does not actively have mono for years on end. The active illness is normally just a few weeks. If someone claims their kid has had mono for 10 years, it is absolutely time to look for another medical explanation. Next question, do children need to be strictly quarantined? Usually, no. The incubation period for this virus can last many weeks, which means by the time a child finally shows symptoms, they've often been carrying it for a very long time already. Plus, a huge percentage of people carry the virus and spread it without ever showing a single symptom. So strict isolation? It just doesn't make sense for a virus that is basically everywhere. Now, what's really interesting about this slide is it dispels a very specific fear. Can your dog or cat transmit Epstein-Barr? The answer is a definitive no. Epstein-Barr is strictly a human-to-human virus, so your pets are completely off the hook for this one. We also really need to address what happens after the worst of it passes. A major concern for parents is that their child is still deeply exhausted weeks or even months later. Guys, this is normal. Recovery takes time. The solution here isn't to hunt down endless medications. What the body actually needs is proper sleep, fresh air, a gradual return to physical activity, and reduced stress. In the past, doctors recommended these super strict restrictions fearing serious complications, but modern research shows that for most healthy people, normal life can return. You just need common sense limits on physical stress while you heal. Which brings us to our final thought. The symptoms of infectious mononucleosis can look incredibly frightening, for sure. But remember, this is one of the most common human viral infections on Earth, and the vast majority of people recover completely. The biggest danger isn't usually the virus itself. It's the unnecessary fear, the unneeded antibiotics, and all those excessive treatments. As this quote perfectly summarizes, understanding the illness is the best medicine, because sometimes the absolute most important treatment is knowing what not to do. Keep that in your back pocket the next time a medical mystery pops up in your household. It really makes you wonder what other common illnesses are hiding in plain sight, just waiting to be misunderstood.